It's a marvel of biological engineering.
For 30 years, Dr. Roberto Carricchio, a rheumatologist at UMass Chan Medical School, and his patients have been fighting an indomitable opponent.
So it's always interesting to explain lupus to lay individuals because I start by saying we have an immune system that protects us from infections. In lupus, that happens as well, but unfortunately, the immune system in lupus, instead of just defending ourselves from infections, it also mistakenly attacks ourselves. And so, and unfortunately, there is no organ spared.
The Lupus Foundation estimates around 1.5 million people in the U.S. have some form of lupus. Many suffer for years before receiving a diagnosis.
The variety of manifestations that lupus can present with, from simple fatigue to really going to the emergency room because the kidneys don't work anymore, and pretty much everything in between.
Talea Reed knows firsthand how debilitating and confusing symptoms can be.
The first signs that I had was a rash on the sides of my nose, and also I was very fatigued. I went to my primary care doctor, and they initially thought that that was a ringworm.
Her symptoms progressed quickly.
I started experiencing extreme stomach pain. They told me that my lupus was not only active in my skin, but also in my kidneys. That's when I started taking all the different medications to try to calm my lupus down, but none of the medications were working for me.
She found hope in a clinical trial with Dr. Carricchio, a new CAR T-cell therapy.
What it is to take the cells from the patient, manipulating them in a way that they are instructed to attack the cells that generate lupus.
CAR T therapy was first approved in 2017 in a patient with leukemia. The results promising. In 2021, the first lupus patient received the treatment in Germany. Dr. Carricchio says it's a game changer.
Without this treatment, we wouldn't know what to do.
Reed, one of just a dozen in the United States, and the second patient to receive the treatment at UMass, says the results were remarkable and immediate. This image of her face rash, a common symptom of lupus before the treatment, and 1 week after. Several months later, she remains medication and symptom-free.
This is everything that I hoped for with going through this treatment, was to come out not having lupus anymore. And before, I didn't know if that was a possibility. I thought that was something that I would have to deal with for the rest of my life. So I'm forever grateful.
That's incredible. And a second UMass patient was dosed in July. So far, neither patients have had a lupus flare-up since receiving the treatment.
Doctors are quick, though, to stress that this is experimental, and it really will not be until the end of the clinical trial that they're in right now before they know the efficacy, both as a treatment and potentially as a cure. So very promising, but not done with the trial yet.
Coming up, a difficult diagnosis and a reason for hope.